That's okay. So are we live now?
Yeah, I could just go ahead and do a quick introduction. So, hi everyone, welcome to another virtual shadowing session. Today we have our amazing guest, Dr. Maan, and she will be sharing her journey to dentistry and some interesting cases. So, Dr. Maan, whenever you are ready, you could go ahead and start.
Hi guys. So as Eva said, my name's Rabia and I'm a dentist in London. Um, I thought I'd take you a bit through the process in London, how to become a dentist, what's expected, some tips of getting in, a bit about my career, a little bit about what oral health and dentistry is. So we'll start off with what is oral health. So this is for those that are actually applying to dentistry. I'm sure you already know, but I came across this interesting fact about dental decay, that it actually is affecting 3.5 billion people worldwide. And it's shocking because it's a completely preventable disease. It's caused by sugar and not brushing well enough. So it is shocking that you could get a population of 3.5 billion worldwide, people being affected by something that's just caused by these two things. And it's caused by, lack of fluoride in certain countries, but mainly in the Western world, it's by sugar and by poor oral health. And that's where dentists come in. So people like myself and people like you in the future, the job is diagnosis, prevention, and treatment. So with oral health, people think it's just to do with teeth, and it largely is to do with teeth, but it's also to do with the gums, which attach the teeth to the jaws, the facial tissues. So you can be treating things like gum disease or, diagnosing oral cancer. And if you go on to certain specialities, you can also be treating oral cancer. The focus at the moment, well, not even the moment, it's always been in dentistry, has been prevention, but that's not really touched on often because people go on to talk about the drilling and the filling aspect, which is what we are notoriously famous for, that scary side of dentistry. I've got a picture in the background here, actually. So I'm doing another webinar for a UK-based cohort of dentists. So they wanted to see what the equipment looks like. So you can see in the picture, you've got a dental mirror, you've got a probe, and those are the main things that you'd use in a dental checkup. So you're using it to examine the teeth by indirect vision. So you put the mirror in and you look in it and you can see the top teeth. So that kind of just a little bit of an idea of what you're kind of doing the examination with your equipment. The probes will help you check the teeth and the gums, and you assess the soft tissues. I'll touch a bit about my education. So in the UK, we can go straight from high school to college to then into whatever field you want to study. I understand in the US, you have to probably do a few foundation degrees or other degrees. I'm not fully sure how it works, but in the UK, they expect you at A levels and GCSEs to have A's and A stars. So I think it might be similar in America, where they expect you to have the highest level of rating or level of your degree. Not really sure what you guys call it. My own education, so GCSEs, I had 11 A stars to A's, A levels I had 4 A's, which has been changed. So I qualified a while ago. So I was doing dentistry in 2009 and I qualified in 2014. So I did my A levels a little while ago. And then my degree in the UK, it's called a Bachelor of Dental Surgery, a BDS, and I finished with honours. I went to Barton in London, which is a London Dental University. There's only 2 in London, but there's quite a few dotted around. Again, this is the UK kind of theme of what happens after dental school. So you can go into things called foundation training, which is what kind of qualifies you to work in the NHS. And then you have hospital years, what we call dental core training. So if you're ever thinking of moving across and you want to work there, you'd have to do something called DCT 1, 2, 3 to move up the ladder in a hospital-based area. If you decide not to, like myself, then you can become either a general dental practitioner, an associate, which is somebody who works for someone else, or a practice owner like myself. And there's other things like, going into salaried dental services, which is like community, working with those with special needs, armed forces. You can go into teaching, which I do a little bit of on the side, and policy making, which I'm not going to do because everyone hates the policy makers. So I myself, like I said, I'm a general dentist. So my typical day, so I'm guessing you're in the 16 to 18-year-old cohort, or those that are doing a second degree, so you might not have an idea of what it's like in a dentist day. I see about 30 patients a day. When you work in a private clinic, so mine's mixed. I do both private and NHS, and the NHS is like the government funded scheme where they pay a little bit and patients then pay the rest of it. I see about 30 people in a mixture of private NHS patients. I see children, I see adults, I see those that have been for appointment and then come back, or brand new patients. I also, because I own a practice, have something called principal duties. So we call the principal when we own a practice. And we do things like managing staff, dealing with complaints, compliance, finances. There's a lot that goes into running a practice. And I only bought my practice last year. Yes, the beginning of lockdown last year. So it has been very, very tough in the steep learning curve. The other parts of my day are things like doing referrals. So if a patient comes in, they've got gum disease or a complex treatment, referring them off to a specialist or a hospital. Also things like referring people for oral cancer or unsuspected lesions. So when it comes to soft tissues, it's not just cancer you might find, other things that you can't quite explain, and that can be sent to the all medicine department. I also do a bit of social media. I'll show you my Instagram handle later and you can message me on there. I'm actually better with my Instagram than I am with my WhatsApp. So feel free to drop me with questions if you do. And I enjoy doing that. I do my social media for fun to teach. I started it about 1.5 years ago. And it's just a bit of a hobby I do on the side. It's got a bit of my lifestyle and things like that on there. And then treatment. I do a variety of treatments. So being a general dentist, it's kind of like being a general doctor, where you kind of haven't honed in onto one specialty, but you do a bit of everything. And I love doing a bit of everything. As you can see in the pictures, I like taking teeth out. I like doing root canals. I don't know if you can see my mouse moving, but I'm kind of moving it over the procedures. I like doing fillings. I do a bit of facial aesthetics. I do Botox. I did train in fillers, not a fan personally, so I don't really do those. This is a crown that I've done for an old lady, and on the bottom left, her tooth had snapped off. So we did a root canal, we placed a post in it, and then we put a crown on top. This lady here on the top, she had really skinny teeth on the side, which is what we call peg laterals. And her last dentist put some fillings on them, but as you can see, she didn't like the look of them. So I redid them for her. And then orthodontics, they could do a bit of that, teeth straightening, also do Invisalign. On the top right, you have a patient that had broken their tooth and then an emergency filling on top. And then some composite here, which is like a white filling material that you can directly build onto the teeth just to close the gap. So you can do lots of things when you work in general practice. And that's why I like it, because I couldn't just do one thing all the time. Practice owner. So this is what I am now. So though I do still work in general practice, I own my own practice. So it's completely different to being employed and working for someone else. Running a business is something you're not really prepared for in dental school. I don't know if it's different in America, but it was like a baptism on fire last year, because it was COVID, it was a pandemic, they had new regulations, new personal protective equipment that you had to work with, guidelines of social distance. It was a bloody nightmare. I could talk like 5 hours on just this topic, so I'm not going to touch it. But this is my practice. It's a 3-chair practice. This is the main room. That's mine. On the top right, you can see just a reception waiting area. It's a small practice. It was an old house that was converted into a clinic. And that's my brother in the middle and my husband, and that's me. And we bought it together. And you can see how shattered we look, because it would just a very long day of signing paperwork and getting things sorted. So yeah, that's the day we bought the practice. Social media. So a lot of people ask me, what it is about social media that I like, and would they advise that I start one? I personally did not use social media before I started my Instagram. I didn't have Facebook, I didn't have Instagram. It was actually my husband that said, okay, you need to get onto social media. It's a good way to connect with people. It's a good way to kind of be different and market. But our practice has been busy already because it's been established for 30 years. So I didn't need it for marketing, but it's actually very fun to kind of find myself on it. And my social media is very different to all the other dentists where I chose to actually teach. So I make videos. Because of the pandemic, I've stopped for a little bit, but I make videos on, this is actually probably a perfect way for you guys to learn about dentistry, but I make videos on dentistry. So I have things about root canals on there, about fillings, oral medicine, dentures, you name it. It's kind of on there. Kids' teeth, making crowns for kids' teeth. Yeah, there's lots and lots on there. And the latest video I popped on was 13 reasons why you hate dentistry. Believe it or not, a lot of people who qualify as dentists actually hate dentistry. So it's a good video to watch, so you can see what people's complaints are. But I think it's really important to have a long, hard think if that's something you want to do, because I know you've spent a lot more years in America becoming a dentist than you do here. So we kind of finished college at 18, and then you go into dental school. 19, you're in dental school, and you come out at 24, and you're a dentist. So, in a way, I kind of think your way is better because you kind of already know whether this is something you really want to do, and invest a lot of money in. So I chose my social media to educate and network. And I've actually done quite a few projects, and there's one that's going to be released soon that I'm quite excited about. I'm not allowed to say what it is, but hopefully it will help people like yourself and dentists and those that qualify as a guide. I'm not allowed to say what it is, but you kind of can get it what it is. So that should be coming out soon. Hopefully that will be helpful. And yeah, that was all through social media and connecting with people. So if you're thinking of starting a social media, I'd say go ahead. It's fun, but have a purpose. Don't just do it because everybody else is, because it takes a lot of time, and it has to be something that you enjoy. So, kind of have a reason why you're doing it. As a dentist, I also do some lecturing at King's College, and I did some teaching at some other universities as well. And it just kind of an insight into the dental world of what to expect when they're a dentist. And I really enjoy it. And I think being a dentist working part-time is one of the advantages. So you can do things like social media, you can do lecturing, you can do charity work. So I actually went to Calais, oh my God, I don't know how many years ago now that was, 3-4 years ago, because they burnt those camps down, unfortunately. It's where all the refugee camps were. And we did dentistry, as you can see, from huts for refugees, and lots of little children. It's actually quite emotional. When I think about it, it makes me emotional. Just kids in pain because all they really eat was sugar and rubbish, and they had just cavities in their teeth. They had poor access to any dental services. So they only had people like us coming in, volunteering and helping them with their dental work. So yeah, that was a eye-opening trip, seeing how people live, and then you meet people from all types of backgrounds. And being a dentist, obviously, it just felt like you were making a difference there for those people. And then the Citizens Foundation is another charity that I give to. So I also, not anymore, I used to get a lot of DMs for this, but I used to mentor for charity. So all the money that I would do for the mentoring would go to some of these charities. But now, because I have a baby, I am very, very busy. So I had a baby in January, so I'm super, super, super busy with her. So it's really hard to mentor. Applying to dental school. So these are just kind of a bit of a summary. You have to have the good grades. So I always tell students here to just reassess. If you think you have the grades, then go for it. If you don't, then do something about it. If you have to retake, if you have to take a gap year, if you have to work hard now at the current degree that you're doing, then just do it. It's not worth having to repeat things again and again if that's not something you want to do. So just have a clear vision of what it is that you want to achieve. In the UK, we have an aptitude test called UK CATS. So that's something that we do here. I'm not sure if you have it out there, but I'm sure you have something similar, but it's to help differentiate between students. So if you were applying in this country, you would have to have done that. And it kind of just checks out things like critical thinking, and just kind of sets you apart from other students. So they kind of use that as a differentiating point. Work experience. I'm assuming this is what this 1 hour is virtual shadowing. So it gives you an idea of what dentistry is like, and I'm happy to answer more questions at the end. But it is kind of important to know if that's something you want to do. I would definitely have a flick through my social media. I have some highlights here on the top of my page, and if you just go through, there is a highlight on root canals, there's highlight on prevention, talking about oral cancer, dry mouth, there's oral medicine, talking about all sort of people on blood thinners, there is a highlight on perio, which is gum disease. So it covers a lot of dentistry on my page, and kind of a short, easy way to understand. And there's lots of videos along my feed as well for you to have a look at. If you just click on IGTV, you'll find it, and that's a good way to kind of get an insight into what a dentist does, because I have a couple of friends who spent 5-6 years doing dentistry, thousands of pounds, and then now have quit to do completely different jobs, either one has decided to not work at all. The other has opened up a cookie business. Yeah, so she's creating the cavities and I'm filling them. But yeah, it's just important to kind of understand if this is for you. And if you get halfway through dental school and realize it's not for you, it's a bit of a pain than if you realize after. But if that does happen to you, it's absolutely fine. Just change your mind when you want. When we apply to dental school in the UK, we have to have personal statements. So personal statements is kind of just like an A4 summary of you as a person, because when we're going through applications, it's not just grades and UK Cats we look at, we also look at this and we read about whether you're an interesting person, which is why I put be interesting. Do things that have transferable skills if you haven't done anything yet, like whoever, Eva and Daniel who set up this platform, that's great. It shows that they're taking initiative, they're doing something interesting, they've learned transferable skills, communicating, networking, IT. There's just so much that they've done that they can now put on their personal statements that will look excellent. Sorry, I don't know what you guys call it, but it's a similar thing where they want to see that you are more than just an A-star, straight A kind of student. They want to see that you're able to manage your stress, that you have things to do in your spare time, like sports and charity work, that you are creative. Because I should have put the facts in here, but dentistry is one of the professions with the highest suicide rate. I will find the facts for you and put it on my story today. But yes, it has a high suicide rate. And I think a lot of it comes down to the isolation, the high litigation, people doing a job that they don't really like in a closed room looking in mouths. And if you don't enjoy it, then it can get very depressing. So it's just important to have outlets. I love dentistry. I'm really sad. I knew I wanted to be a dentist since the age of 12. So I love it, but I love it doing it 3 days. So as soon as I qualified, I had to work full time, but then as soon as I could, a year after, I dropped down to 4, then I dropped down to 3, and 3 is just right for me. I work Monday, have Tuesday off, work Wednesday, have Thursday off, work Friday. And it's a big reason why I did dentistry, was that I could work part-time and do other things and socialize, because it can be very intense because you're dealing with people in a very small area, charging them what they feel is a lot of money, but when you qualify you'll realize actually it's not a lot of money, because your courses cost a lot, your equipment costs a lot, your material costs a lot, the overheads, now I own a practice, I know, cost a lot. Your nurse, the room, the running, the bloody equipment. It's just, and if you're up to date like my practice is, you're investing in digital, the latest equipment and material, oh my goodness, it costs a lot of money. People ask me a year out, do I earn more now I'm a practice owner? No, I think I earn less, because a lot of it goes into overheads, paying off your mortgage, and it's just dealing with all the daily stuff. So yeah, it's important to have balance, I think, and it's a hard thing to learn. So kind of find your skills now and find things in hobbies that you enjoy now. Don't be like me and make your job a hobby. And personal statements and applications. So when you apply to dental school, just get as much help as you can. Reach out to people who have already applied, and just get their advice, and just read up about it a lot, because in the UK we really kind of just get one shot and then you have to apply next year, and your odds of getting in drop every single year. So I always say try to make your first one count. And like I kept mentioning, know your why. If you don't have a clear-cut vision as to why you want to do dentistry, it's very hard getting through dental school and getting into dental school. Once you kind of sit there and have a think about it, if this is the kind of life you want to live, and if you're still not sure, like I said, look up about it, read about it. I think it's a fantastic career, which is why I do it. I find that it's very rewarding, it's enjoyable, it's flexible, and there's just so much variety. A lot of people say, oh, I'm passionate about working with people and helping them and working with their hands and manual dexterity, all that. That's all true, but there's just more to it. And I really enjoy the teaching side of things as well. So, find you through dental school, find yourself before if you can in things that are different, and you can always bring them into dentistry. But yeah, that's what I have to say. If Eva or Daniel have any questions, fire away. And hopefully I can answer them for you guys. Hopefully that was a useful presentation.
All right, Dr. Maan, thank you so much for that amazing presentation. I'm just going to go ahead and ask some questions, okay?
Yes, go far ahead.
Okay, so first question, I know you talked about a lot about how difficult it is to run an office and the cost and everything associated with it, but what do you have like I guess one thing about owning an office as like the most difficult that that you would rather wish not to handle and everything is.
So me and my husband and brother bought it together. So I mainly handle staff and patient complaints. That's kind of my brother does like the finances at the moment. My
Mhm.
husband runs it like the practice manager, and I do staff handling and patient complaints. Bloody hell, that's the worst part. That is the hardest part because staff and managing people is very, very difficult. You know, they come with their own emotional baggage, their own problems, and just think about yourself as an individual, how many issues you might have, and then multiply that by the number of staff you have in an industry. And when you're a smaller practice like myself, you rely on each staff member heavily, because it's not like it's a big practice when you've got 10 surgeries. It's fine, you can kind of swap and change the staff, you can close one and run. But for me, I need to make sure both surgeries are running. I need my receptionist there because our phones are so busy. If one calls in sick and the other's running late, then who's going to open the door? It's just working on team dynamics and making sure they work together. I sometimes laugh with my husband and say, if we just get rid of all of them and just have robots, that would be fabulous. But I think it's an art learning to deal with people. And I think it's a really, really important skill to pick up. If that's something people can work on now, communication and working with people, that's so, so important. Not just owning a practice, but being a dentist. One of my friends that quit, it was because she hates people. She actually said to me, she's like, Robbie, I hate people. I hate their drama. I hate their complaints, and you can't please them. And she just pretty much why she left dentistry. So she realized a bit late that it wasn't a field for her. So, yeah.
Right. And another question is, do you have any advice for any international students trying to apply to dental school?
In the UK, because they kind of have a preference to take on UK graduates, but we do have intake of international students. They just have to pay higher fees, so it is quite costly. So I would advise, making sure you've got the funding, and then speak to people who've already done it beforehand, so you know what the application process is like. I don't know if you have to pay to apply as well. I wouldn't be surprised if they make you pay, because they're always trying to find ways to make money. So definitely have all your wits about you and get all the knowledge you can before applying. And don't just apply to London dental schools. The likelihood of you getting into London is a lot harder than getting into like Scotland, Bristol, Birmingham, Manchester. They're a lot easier to get into. So definitely just apply everywhere.
So did you work at all when you're going through dental school?
No. So a lot of people do. And my husband always laughs at me because I actually never had a job before I went into I was very privileged. I never had a job before I went into dental school. But that's because my dad was very much like, no, just study, study, study. And don't worry about work. I, up until recently, used to think that was a great idea because I managed to study and do great. But my husband did both. He did a job and did that, and he felt like he learned a lot from having a job. I think up until dental school, if you wanted to work a job and do your thing, like degree or whatever it is that you do before, like uni or college, that's usually okay. But I think dental school can be pretty intense, and there's a lot of work involved. So sometimes juggling it with a job and trying to have a social life, it can be a bit much. But I would tell people, if that's something that they need to do to help them get through dental school, I completely understand. But they just need to find a way to balance it all and have a job that maybe perhaps isn't so intense, so that they have a breather, because you kind of need a break sometimes with dental school.
And speaking about jobs, so how difficult is it really to get a job, I guess, post dental school? And like, it will be harder, like compared to a general dentist versus like a specialist of any kind?
Getting a general dentist job is actually pretty easy because there's a lot of dental practices out there. But when you're newly qualified, especially now in COVID times, people are kind of struggling because a lot of the people applying, the dentists that are hiring, know that they haven't had as much experience and they're a little bit more nervous. And some of them just will pass through the years without more rigorous examinations than the other one. So it is a bit more tough for the new dentists coming through. But generally, there's always jobs to go into. If you go into the national health scheme that we have in the UK, then you kind of get in pretty much straight away. You just have to sit a few interviews and exams, and everyone pretty much makes it into the first year of working for the national health. And after that, if you kind of prove yourself as a go-getter, I did a talk a few months, actually not a month, it was pre-COVID, I did a talk about getting in your job that you'd like. God, where's this year gone? Talking about the job you like to get into, and I had somebody message me after and say they got the job because they did what I said, and what I said was, fake it till you make it. You know, when you're newly qualified, nobody wants you. No offense, nobody wanted me either. But you have to make them think that they want you. Got to tell them, like, you know, I'm young, I'm willing to learn. I know, you know, X, Y, and Z. I tried everything in my first year out. I'm keen. You know, if you've got social media, if you've created a platform like yourself ever, it just shows your keenness. And I just kind of made the interviewer say, like, you need me, you want me, and that, because I like kind of faked it to make them believe it. They're pretty much, because on her advert she actually said 3 years experience, and I applied, and I made my CV really pretty, made it different. It was a very artistic CV, it wasn't a standard CV. So she was interested by it, and she was, I just called you because your CV looked good, but I can't really give you a job because you don't have the experience, but I'd like to hear what you have to say. And then I just sold myself to her. And she actually gave me the job. And my first job out was working in a clinic that wanted somebody with more experience. So I think you just got to have some confidence in yourself coming out, and then the world is your oyster, really.
Oh, that's awesome. Guess we all got to take this, right? So what is the most challenging thing about, I know, like you mentioned, like, you know, owning a business, like, challenging because, like, the everyone has, like, their own issues you got to deal with, but, like, about dentistry itself, like, what's the most challenging thing about it? Is, like, there's a certain procedure that you really don't like, or is there anything sort of specifically?
So when I was newly qualified, I would have to say I used to hate root canals, because it's just like blind. There's everybody, pretty much 99% of dentists hate root canals, especially in dental school and being qualified. It's just like, it's like, I'll show you. I don't know if you can see this picture. So this is the most straightforward root canal you can do. This is a premolar. Can you see in the top left next to the extracted tooth here, right? And this is a zoomed in picture of a hole. And inside this hole, there's 2 canals, and it's about 21 millimeters in length. And you have to clean it and fill it. And it's just, you're absolutely blind. This is why we advise, if you look at my first picture, magnification. So we call this loops, and it's something really worth investing in. And it kind of gives you a magnified image of the teeth, so you can work on them a bit better. I know in the US, you actually have to buy them in dental school, whereas in the UK, you can buy it after. But the idea is it's all done by feel. So initially, when you're just trying to hone in on working in position, looking at teeth, learning to work with your nurse, learning to work upside down and working through a mirror, and then you've got this tooth that you can't actually see what you're doing. It's a nightmare, and it is all about feel and patience. So it was only after I qualified that my training year, which I used to sweat when I knew I had to do one. I'm like, oh my God, I'm panicking. And then my trainer used to just give me loads and loads of root canals to do. And one day I did like 9. I wanted to die that day. But because he gave me so many and I practiced so many, I just got really good at it. I don't particularly enjoy them now, but I don't hate them either. So I would say that's probably the procedure that most dentists will tell you that they hate. But now I would say, what do I dislike? Dentures. Not a fan of dentures. That's because the patient doesn't like them. No patient you'll ever hear actually says, oh, I like my fake teeth, you know, I like my false teeth, because they're plastic, they're uncomfortable, the patient's usually old, you know, so it's just a bit of a nightmare making them. So not a fan.
Following up with that sort of idea, when do you guys decide to sort of do those procedures, like root canals or like the extractions, like in-house, versus like when you guys refer them out to like the specialists?
So you actually have like a criteria. So when you're studying, you'll realize that's not everything is. So if someone needs a root canal, oh, it's just got 2 things and we fill it. No, each tooth is very different. Some teeth are like curved and you're trying to get the file in, but you might end up coming out the other side. Sometimes you might create a hole in the wrong place when you're doing a root canal. So, either if you've got a complication, or if it's a very complex tooth anatomy, or you can't see what's going on, or if the patient has a complex medical history, so you end up referring those kind of patients. And with teeth, for example, if the tooth is in a very dense bone, or if it's a wisdom tooth that's not at the right angle and it's buried in bone, and you need to cut the bone and cut the gum, we are trained in dental school to do that. But when you go into general practice, you kind of do a bit of everything. That's very rare that you come up with wisdom teeth extractions and complex root canals that when it does come, you're like, oh my God, I don't remember how to do this, or I don't have enough practice. So you tend to refer those kind of cases to hospitals or private clinicians to actually do a better job. And I always say to my patient, look, I can either attempt this for you, but if it was me, I would rather see a specialist for this. That's what I'm telling you about my skill in this area. And I think it's very important to be honest about your ability to complete a task, because you have to imagine that if it was your parent, would you want to be doing that procedure on them? If not, then you shouldn't be doing it on your patient either, because it means you're not comfortable doing it.
So how do you and your office stay up to date with the new innovating techniques in dentistry?
How do we stay up to date? So all of us are constantly doing courses and CPD, which is core development, and we all have a personal development plan of what we want to achieve. So when you qualify, it's really important to first do your training, do everything, and then see where you need to develop, where are your weaknesses, what do you enjoy, so what do you need to improve on, and what would you like to grow in. And then when you do that, then it's important to then find things to help you, extra reading material or extra courses that you can pay to go on to, mentors that can help you in those fields. And then you have to look at the equipment that complements those particular things. So I like doing orthodontic treatment. So here is when I did a fixed case. I actually don't do as many fixed cases now, because you can do a lot with Invisalign, which is an invisible clear straightening system for those that don't know. They look like retainers, and your patient changes them every few days or weeks to get to the desired tooth position. And they've become so advanced that you can do tooth movements like this with them. Before it used to be a lot less complex, and now it's complex treatments that they can do. So I use that more often. And so because I enjoy doing that, I went on courses for that. I'm hoping to do a diploma in that. And now I've bought something called a scanner, iTero scanner. So that costs thousands of pounds. So we've just invested in that. And what we can do with that is scan patients' teeth. Because a lot of dentistry now is going digital. So the future of dentistry is digital, and you can scan the teeth and show the patient immediately, this is what your teeth will most likely look like when you finish your orthodontic treatment. And with that, you can also take an impression. So I don't know if any of you've had braces or sports guard made, and you get that dirty kind of gummy, disgusting flavored stuff put into your mouth to take a mold of your teeth. This digital scan is basically a digital version of doing that. So patients that had a gag, or didn't really like having that cold putty put in their mouth, can now have a scan taken, and then that's sent off to the lab, and they can have their aligners sent back in half the time and a lot more accurately fitting. Because sometimes with the impressions, you've got human error, where you can have bubbles in certain areas where it hasn't captured the teeth properly, or you've missed off certain teeth, whereas a scan will just kind of accurately get all the soft tissues, get all the teeth, and get the bite correct, and off you go. You've got an excellent treatment plan. And then you find the treatment's more predictable as well, because if the scan is better, the model that they make the teeth on will be better, the aligners on, sorry, will be better, therefore it will fit better, therefore the treatment outcome will be better. So you find that they progress better throughout the treatment as well, and patients are just generally happier when they see something digital. They're like, ooh. So yeah, so we just make sure we invest in what we kind of want to excel in.
So would you say that the orthodontic work is sort of like your favorite procedure you do, or is there different type?
Yeah, so I try to kind of, because everyone's going, if you go into Instagram and you follow any dental pages, everyone pretty much does the whitening, straightening, composite on everybody's teeth, and then they've got facial aesthetics. Everyone's doing lip fillers and Botox. So I thought I'd try it. I kind of got sucked into that social media. Okay, everyone's doing this. Let me give it a go. So I did some fillers, Botox, hate fillers, not going near it. Absolutely find it weird. I did my nurse's lips, my receptionist's lips, and they loved it. And they're kind of filleraholics now, but I'm just like, no, not doing it. It's so weird. It's like so not dentistry for me. Putting stuff into people's faces. But Botox, I really enjoyed. I love doing Botox. It's really fun. I think because it's very similar to giving anesthetic. You kind of just put it into the muscles. You have to and because you have to understand it, you can't just stick Botox in someone's head. You have to understand that, this muscle lifts. Therefore, if I put injection here, it's going to drop the face unless I inject here, because this is the opposite acting muscle. So it's a bit more kind of, accuracy involved in doing the Botox, and you're not really injecting a substance under the skin. You're kind of injecting a toxin to relax the muscle. So I really like the kind of science kind of thing behind that. Whereas filler, although it's very artistic and I see people do amazing things, some of my friends do wonderful cases, I just don't feel very comfortable. It feels too far away from dentistry for me. But I do like Botox. I do like doing orthodontic work, and I actually kind of enjoy doing fillings as well. I find it really therapeutic, just removing the decay and placing a filling. It's really nice to kind of just see the after effect. And emergency work, like that lady who broke her tooth, and just kind of, she looked in the mirror, she's like, oh wow, my tooth back, thank God, because she was going to a party. And this lady, she was going on a cruise in 2 weeks, and she was just like, oh my gosh, she was 80 years old, and she was like, I really need a tooth, and just kind of putting that back for them. So sometimes it's not exactly the procedure, but it's the outcome that you can achieve for the patient that I really enjoy. And even this lady was very young. She was only 8. No, she got this done when she was 18, but I did a treatment when she was 21. So, she kind of cried in the chair because she was like, I've been like this 3 years, and it's just so nice to be able to smile and just look normal. So I think it's that, the impact you have on your patients. That's the enjoyable part, definitely.
Talking about treatments, have you in your office seen any sort of changes in the types of like procedures that you guys have done ever since like COVID has started? Like, have you guys seen more of like a specific procedure or like less of any?
It's interesting because when COVID happened and all the clinics were shut down, we kind of operated on an emergency basis only. So we were taking a lot of phone calls, and it was all just kind of emergency work. Oh, you're in pain. If there's swelling, okay, here's some antibiotics, this. And so it was a lot of emergency work initially. And then when we cleared the log and then the guidelines opened that we could do normal work, a lot of people had been on like furlough, not going on holidays, so they had a lot more money saved up. So then they started going for the nicer treatments that perhaps they might have not done in the past, like Invisalign, like going for a white crown rather than a silver crown on the National Health. So I just noticed a lot of people investing in themselves a bit more now, which is good. And then I kind of went on maternity leave, so not sure what's happening currently, but I do go back to work in about 2 weeks. So it will be very interesting to see what dentistry is like when I go back.
So moving back to when you were talking about dental school, how different is it in dental school, like the things you learn and how you expected of dentistry versus like what dentistry is sort of like really is when you're actually like, you work in it now? So how much does it differ?
I think it's very different because in dental school you have ample time to do everything, and there's no discussion of fees. So in dental school, patients come in, you might see them 150 times just to do one root canal, and you can spend hours and hours just doing this one procedure, and it's all free. So you don't have to discuss things like money, and you're taught. I always say to the students that I speak to that are in dental school and that qualify, that in dental school is there to teach you how to be a safe dentist and kind of expose you to the different treatments. It doesn't necessarily teach you how to be a good dentist. And you learn a lot of that in your first year qualified, where you will experience a vast array of treatments, where you will learn how to do it within time, to different techniques, because dental school kind of teach you, it depends what tutor or trainer you get, but they teach you a way that they like. But when you come out, there's so many materials, there's so many techniques, and social media exposed me to a lot of different techniques and materials as well, which is why I find it fantastic. I'm like, oh my God, look what they're doing in Indonesia, or look what they're doing here in Japan. And they're just doing like awesome different treatments. And I'm like, oh, I want to try this, and you'll try something and like, oh, wow, this is so much cooler than what, Mr. X taught me in school. So it's that, and it's also understanding how to do it in a timely manner, discussing costs with patients, understanding the business side of things, and not just the here's a hole, this is what a hole looks like, I'm going to fill it. It's more like, oh my God, there's 70 things I could fill it with, there's different techniques that I can fill it, I can use to fill it, and it can cost X, Y, and Z, and and I'm going to do it my way. rather than the way I was necessarily taught, and I'm doing it my way because this is what the latest evidence shows. And in dentistry, because of the materials constantly evolving, the evidence is coming out for the materials are evolving. So that can be quite stressful, because I always find that there's something new. I'll be like, oh, okay, I've learned about X way of replacing a tooth tissue that's lost, but then somebody's come out with this new glass fiber mesh that you can use and stop shrinkage and pain, and you should be using this. And I'm like, oh shit, okay, I need to use this now. So it's just staying up to date. I think that's the hard part when you come out. There's no more spoon feeding. You have to constantly study yourself and learn and grow, and be committed to the profession to become a good dentist.
So I know you mentioned earlier how like when you're at dental school, they don't teach you at all how to like, run your own business and everything. So do you think dental schools should actually change that? Do you think they should actually start like teaching, like, I know you mentioned that you have like unlimited time to do a certain like procedure, like the root canal you mentioned earlier. Do you suggest dental schools to allow more restrictions to make it seem more like real life about what life will be like after graduation?
In terms of business sides, yes. I feel like they should teach you that, because a lot of people that apply to dental school, they're like myself, they're academics. Like I said, I didn't even have a job beforehand. So I was a bit, you could say coddled or in a little bubble when I came out. So I just knew about studying, and I knew about getting A's, and then knew about going through dental school. But I didn't understand how, the financial side, how the business side of things worked. And, I remember I almost actually, I was pregnant. In all fairness, I was when I bought the practice last year in April. I actually found out I was 1 month pregnant, as well at the same time, and it was a pandemic, and then it was a bit of madness. And then I was about 4 or 5 months pregnant when we could open things up again, and I had to hire a staff member, and I had to fire her within 2 weeks, because number one, I didn't think properly when I'd hired her, because I didn't know what to look for. She just seemed very sweet. And I won't say why I had to fire her in case she ever finds this, but then we had to fire her. And my brother and husband were like, you hired crazy pants, so now you need to fire her. So I had to fire her. So learning that whole process of what to look for when hiring someone, making sure you're getting references and not just going off the fact that someone seems very sweet, but seeing what background they come from and how they're going to fit in with the team. Then learning the process of firing someone, giving them formal notice, and just learning basic things like that, like hiring and firing and finances and accounts and purchasing a practice, and all those things we had to learn ourselves. So no one taught us. To sit there googling, speaking to accountants, speaking to my brother-in-law who owns businesses. So how do you do it? Like, what's the process? And speaking to my sister-in-law who's a lawyer, like, what's the legal way of doing things? Writing up staff contracts, what should we include in there? So I think it's really important. They should teach that in dental school. I don't know why they don't. They definitely should. But in terms of time restrictions, I would say no. Reason being, like I said, they need to teach you to be a safe dentist. And if all the focus is on time and speed, you don't get time to kind of practice and hone in on those skills. Initially, that's like with any skill. I'm teaching my baby to eat now. I've started weaning her and just watching her eat. There's like food in her nose and her hair and her arms and her clothes, but there's like very little in her mouth. So if I focused on speed right now, she wouldn't learn anything. So right now she's learning about textures, and she's learning how to hold things and see things. And I think in dental school, you have to learn how to be safe and how to communicate with patients and how to do a certain procedure the right way. And then when you become good with it, as you practice and you practice, the speed will come. And usually I find in the first year that does come. But yes, definitely the business side of things they should teach.
All right, Dr. Maan, I really appreciate all the advice and answering all those questions you had for us. We could just about wrap it up now. And I want to thank you again so much for this amazing presentation. And I want to thank all the viewers for tuning into the session today. And just a reminder for everyone to take the quiz after the video, so then you can receive your hour of shadowing. Again, thank